was when I was small. I was like 7 or 8 years old.
But you have at least the sense of the Portuguese language,
Yes.
if you right.
I can understand a lot of it, but I can't speak it.
Yeah, it's a matter of practice.
Bom dia a todos. Estamos aqui no podcast da Sociedade Carioca de Neurocirurgia. Vamos conversar hoje, eu e o Dr. Bruno, com Manuel Reuter, nosso especialista em neuropsicologia, nosso convidado internacional. Vamos ter aqui uns 10 minutinhos para a gente poder discorrer a respeito da história dele e do uso da inteligência artificial em neurociências e neurocirurgia. Certo, Bruno?
Certo, perfeito. First of all, thank you so much to stay with us here in Brazil. Manuel, it's a great pleasure for us. And I wanna start off make some questions about your life. Of course, it's extremely important because our background makes sound about everything that we do in our daily life activities. So, in summary, how can you summarize your life, your history, how you get access to KEEG, how do you see the importance of KEEG for neurosurgeons usually?
Yes, so thank you for having me here, and I really appreciate the opportunity to talk about this. So my background is I was in the United States Army Special Operations. I was an operator for about 14 years. I had 8 concussions, was deployed 8 times, and got shot once. And so when I retired from the military, I had some issues due to my concussions. I was irritable, I had some depression issues, and when I went to a mental health professional, all they could do is basically I told them my symptoms, then they put it in a package and gave me a diagnosis. But really, I did not know how that affected my brain functionally. So when I got into looking at EEG, and I finally for the first time saw how my brain was functioning or not functioning the way it's supposed to, it all made sense. And it helped me to actually then look for certain types of diets and certain, also do a hormone test labs and all those things to help my brain recover faster. I started doing neurofeedback as well, and also photobiomodulation, which made a huge difference. So after I retired, I really fell in love with EEG because the soldiers that I worked with afterwards, I saw tears in their eyes because for the first time somebody could actually show them, this is what's going on with you. There's nothing really wrong with you. You're not going crazy. There's a problem with your brain that we can now see, and we can look at the dysregulation and actually make a difference, change that. Whether it's through surgery or whether it's through diet or neurofeedback, whatever intervention you want to look at, you can then actually look at the brain after the intervention and see how it changed. How, like for example, yourself, if you do a surgery, you can look at a pre-surgery EEG and then a post-surgery EEG, and now you can see how functionally what the surgery that you did, how that made a difference. And that is the huge thing for not just neurosurgeons, but any kind of doctor and any kind of, we can use the EEG not just for pathological conditions, right, but also to improve performance. So athletes can take advantage of it. We can actually look at QEEG metrics and heart rate variability metrics and decide whether an athlete should be training very hard today or not so hard, depending on their recovery. And we can see that in the brain. So it's for neurosurgeons all the way to athletes to psychologists. This technology can be used. And as you may know, I'm pretty sure you do know, it's a lot cheaper than doing an MRI or an fMRI. And you can see the function in real time of the brain, not just a structural image and seeing if the structure is actually what it's supposed to be.
Right.
And the nice thing about looking at an EEG also is that other imaging techniques show us the structure of the brain, but what if there's a blast injury, a diffuse neuronal injury that can't be seen in an MRI? We can still see the function of the brain or the lack thereof in an EEG.
Right, perfect. And how do you see the future for the QEEG here in Brazil specifically, based on the things that actually you saw and on your market usually?
Well, I think that it can be used by any surgeon, for instance, neurosurgeon, to, as part of their toolkit, and not like, you don't have to stop doing what you're doing already, the interventions you're doing, the imaging you're doing. You can add this on top of what you're already doing, which then adds value to actually looking at the structural, the functional integrity of the brain, not just the structural integrity. So I think that especially doctors or surgeons have an advantage over a lot of other people using this technology, because you guys understand the neuroanatomy and the anatomy of the human body. So you have that advantage already. So now you add this imaging tool on top of it, and you can illustrate in a very simple manner to your patients what is going on with them, without having to go through all these medical terms with the client. So again, it helps communicate with your patients, with other doctors, and it's an additional tool. So I don't think that it should replace anything, because structural imaging is important. Looking at MRIs, fMRIs, and all these other imaging techniques. It's just an additional tool that can help illustrate what is going on in a person's brain.
Nice. In addition to this, of course, you can do the exam in your clinic without hospitalize the patients usually, right?
Correct. Yes, you can even take the equipment to the person's wherever they're at. If they're, for instance, let's say a person can't leave their house and they have to, and you want to look at their brain, you can actually take that technology with you to that person's house, do the assessment in a few minutes, and then once you clean all the data and process the report, you can show the person what's going on with them within a few hours.
Right.
So it doesn't take days or a lot of money or a lot of equipment or hospitalization.
Yeah.
It literally just takes somebody who knows what they're doing to go to the patient, do the assessment. And then the person doing the assessment doesn't even have to really understand all of the EEG stuff. That can be done by somebody who is good at interpreting and integrating the EEG data with other data, like self-report measures or performance metrics and so forth.
In other words, you can get access to the technology even though you're not a specialist in this field, right?
Correct.
Yeah.
Yes, and if a person isn't as well versed in interpreting an EEG, there are people out there who offer that service to interpret the EEG and write reports. So literally, if, for instance, if you have a patient and you don't have time to process the EEG yourself, you could send the EEG or the raw files to somebody like myself. I could write the report for you, give it back to you, explain to you what's going on, and then you just take it to the client and use that information to either, decide, okay, this intervention worked or it didn't work. But you will actually see objective metrics. You don't have to go by what the patient necessarily says.
Yeah.
I'm not saying we should ignore the patient and what they say, but a lot of times, for example, if I tell you that I have anxiety, it could mean something completely different to me than if you say you have anxiety. Right. So this is an objective way to actually look at brain function that helps us to communicate with each other as doctors, or also communicate with the clients in a way that they can actually understand.
Absolutely, right. Talk about specifically about the disease themselves. How do you see, for example, the role of EEG, for example, for vascular conditions like stroke, aneurysm, and other examples?
Well, a lot of the metrics that we can get from the QEEG, or the EEG, and the quantitative metrics that we get from those that are derived from the EEG, we can actually use that in addition to, let's say somebody has a tumor or some kind of vascular disease. You can do imaging, see that, and then you can also see how it's impacting the person's brain function.
Right.
So we can see, for instance, if somebody has a tumor, we can't look at the EEG and say, yes, there's a tumor, but we can see the activity, like localized slow frequency activity in a certain area. We can look at the connectivity. So if that area is not connected to other areas of the brain effectively, then we know that there's something there that is a problem. Yeah. It could be a structural problem or a functional problem. But if we combine it with like an MRI, we can have both. Yep. So now we see how the brain functions and the structural integrity of the brain. So, and that to me is huge, especially because there's some conditions that we know that there's something wrong in the brain, but we don't really know how it's functionally affecting the person. Right. This will allow us to see that. So
right. Get into this process of QEEG study or an application. What do you recommend for young neurosurgeons, neurologists that are interested in KEG usually?
Mhm.
Because of course we do know as an exam we can assure the diagnosis of the patient usually based on a KEG or other exam. Of course we can help them out with this beautiful and nice device like KEG. How usually what do you suggest to recommend for those doctors?
So what I recommend is that those doctors who are interested in it, that they take a didactic course where they're exposed to a bunch of this EEG stuff in 2 or 3 days. Then after that, slowly as time passes on, they can get mentored by somebody who is experienced in this. And then over time, they can do the work themselves once they've had enough exposure to that and understand what the metrics tell them. So that's what my recommendation would be. It usually would, for most of the people that I've mentored, it takes about 30 to 40 hours of mentorship for them to have a relatively good grasp on EEG. But again, the huge advantage of somebody who's a doctor is they already have a huge part of it understanding the anatomy, the brain anatomy and physiology that a lot of other people who aren't necessarily doctors don't have. So they have to, in addition to learning what the EEG does, they have to learn about the brain's anatomy, which again, it makes it a lot more difficult. But for doctors specifically, I think that anybody who's really interested in this, within about 3 or 4 months, they can have a relatively good idea of what they're doing. That's if they actually get mentorship during that time and also go to a course where they're introduced to all the different metrics and what they mean and what a normal EEG looks like.
Right. Based on those things that you talked, do you think that QEG is underused, not only in Brazil, of course, but in the US as well?
Yes, I definitely think so. And I understand why. I mean, it takes a lot of time and it takes a person with a certain character qualities to do this work well, because you have to pay attention to details, but you also have to be the type of person who can see the big picture. And that is not very common. Also, learning about this stuff, it's quite complicated. There are a lot of little details that you have to put together. So there is kind of an art to doing this, just like being a good surgeon. You know, there's the science that is obviously there that backs up what the surgeon is doing, but what differentiates a good surgeon from a bad surgeon, or a good EEG analyst and a bad one, is there's this quality where the person can actually integrate the science with actually practically doing the work. And again, that takes a certain type of person. But I do think that over time, EEG will play a bigger and bigger part, especially with all the software, artificial intelligence, and all these different software applications that are out there now that help us to actually process data quicker and get it to the client at a cheaper price than what it used to take. Because again, you don't want to, if you pay a doctor or a person to process a report, that used to take, so for some people it took up to 6 hours just to process an EEG. Now we can do that within 20-30 minutes. So again, that saves time, which saves money, and also the technology gives us better pictures, nicer pictures. We can look at the connectivity of different areas of the brain, and also the surface activity of the brain, and we can see if there's a compensatory function, because we don't necessarily want to do away with that. So again, that is what it. So over time, I think because it's more practical nowadays to actually look at the EEG data and the maps and the reports, I think it will become a bigger and bigger tool that people can use. And what will help also is if insurance companies start reimbursing. And that is to me one of the issues that we're facing in the United States, is that a lot of insurance companies, if they reimburse for it, it's not very much money that they reimburse. So that is another problem. That is also why I work in the forensic world now and write reports for different lawyers who have clients who have had a TBI. And because again, that the finances aren't an issue in that situation.
Sure.
So the reason I actually started working in special operations is because I wanted to bring this to people who actually need it. Soldiers who can't necessarily afford to, get all this expensive workup done of their brain function. So working with special operations, they are now starting to use this technology. If special operations starts using it, other military branches start using it. If everybody in the military starts using it, then guess what? Insurance companies will have to reimburse for it.
Sure.
And so we had to find all these different routes into getting this to the people who need it. But it's slowly catching on, and I'm really excited about that.
Nice. Very, very good. Uma coisa mais?
No.
No? Thank you so much.
Thank you so much.
Thank you so much.
You're welcome. Thank you for having me.
Yeah, that's all, folks. Muito bom. Good.
Thank you so much, Manuel. It was amazing.